Hi, I'm Ashwini Murthy, intensivist and head of medical services at Avanta Healthcare Private Limited. I'll be talking briefly about rehabilitation. What is rehabilitation? Rehabilitation is actually an act of restoring someone to health or normal life through a set of interventions like therapy and training. So, it is a set of interventions which will optimize the functioning of a person who has had an injury or illness and will try to reduce disability in patients with certain conditions. It will make a person as independent as possible with their everyday activities. Now, who requires rehabilitation? Anybody can require rehabilitation at some point in their life. Maybe following an injury or some illness or any disease requiring a particular length of hospital stay, or just because their functioning has declined with age. Rehabilitation is highly patient-centered. It has to be tailored to a particular individual's need. Now, rehabilitation can be provided in different settings, either as outpatient or inpatient or in the community or even at the individual's home. The workforce that makes up a rehabilitation team includes many specialists like physiotherapists, occupational therapists, speech therapists, nurses, and doctors. Now, what are the benefits of a rehabilitation program? Rehabilitation can reduce the impact of many different clinical conditions and also in acute or chronic illnesses and injuries. It can prevent complications in conditions like stroke or spinal cord injuries or fractures. Rehabilitation can slow down the debilitating effects in chronic conditions like cardiac disease, diabetes, or cancer. By equipping a person to self-manage with various strategies. Rehabilitation, importantly, actually reduces costly hospitalizations. It can reduce the length of stay in the hospital. It can prevent readmission to hospitals and also hospital-acquired infections. So, in effect, actually, contrary to popular belief, rehabilitation is not just for people with long-term conditions or physical impairments. So, there are various types depending on the condition, and we can categorize them as neurorehabilitation, cardiac rehabilitation, pulmonary rehabilitation, and so on, depending on for what condition we are going to provide rehabilitation services.
Healing hands, care of thoughts.